And that's why you're a power mum. Welcome to the Pwrmums podcast. So you kind of mentioned your career changed as you had kids. Did your interest in women's health increase after you had kids?
Yeah, I mean, I remember a GP saying when I was training, you can only do a baby clinic when you've had babies, you know, because there's some things you just can't learn out of a medical textbook, and it is true. I think that experience as a mum you can definitely bring into to being a GP. Yeah, we have a lot of children in our Katong clinic, so yeah, every day we're sort of bringing that knowledge and looking after children.
I've sat in this waiting room quite a few times. There's always a baby, normally my baby, like crawling around, and lots of babies coming for their jabs and things like that. It's definitely a family clinic.
It's great. Yeah, it's lovely to have that sort of traditional general practice feel, actually, where you're looking after the whole family often. Yeah,
definitely. Nice. So could you kind of go through the typical postpartum kind of experience and checkups?
Yeah, I mean, again, in Singapore, we're really lucky. We have a paediatrician usually at the birth, and you'll see your obstetrician maybe a week or two later for a check. But what we've identified, particularly in our Katong clinic with our patients and other feedback from our patients, is we don't always have that checkup at sort of 6 to 8 weeks, and that's a good time really to check in with mum. Often they come with their babies for the jabs, they don't forget that, but they forget themselves, you know, they forget to look after themselves because they're too busy. So at that point we're looking at, you know, checking the perineum, were there any tears, how's the healing going, have they had a cesarean, you know, is that going okay, any pain, any problems. There could still be issues with bowels, hemorrhoids often can go on for quite some time. It's an important time to think about contraception, so often again women forget about that point. They may not yet be having sex at that point, but we should be asking the question, you know, have you thought yet what you want to do with contraception? Of course, feeding, infant feeding, is it breast, is it bottle, is it a combination, is it expressing, you know, and it's all about what's right for that baby and that mum, so checking everything's going all right there.
And it's quite they're sensitive topics, right? It's not something that someone's going to come in and say, my perineum still feels weird.
No, exactly.
It might kind of get teased out throughout the assessment or when you do the check.
Yeah, and it might be that you're chatting about the little one and then they bring it up when you've built that rapport and they feel a bit more comfortable. And along that line we always should be asking about mood and mental health as well, you know, and checking in at that point. It's a good time.
And I guess you guys have a bit more time with your patients. It's not, I know, like in the UK, what is it? You get 4 minutes or something?
Well, yeah, I mean, we had 10, so that's a luxury. I mean, realistically, you know, 10 minutes, it's not great. Trying to build that knowledge and really understand what's going on, and, you know, it's just a pleasure actually to have the time that we do in Singapore to really understand and get to know, because you can't separate the body and mind. You know, one will impact on the other, so you need to tease all that out and really get to understand what's going on.
And I guess, do you, from your experience of seeing new mums here, are you the first person sometimes to identify that there might be some like mental health struggles going on?
Yeah, that's right. Yeah, so I mean, you may not have a health visitor popping in. It's this different system. People can slip under the net. You might not have family around. It can be quite isolating when you've got a little new one. I mean, one good thing about COVID is the dads are around a bit more, so they're a bit more hands-on, you know, which is useful. But no, it's important to just check in, really.
And what about physical things? So you mentioned like checking the perineum if they've had tearing and things like that. Sometimes it might be that they've had their checkup a week later, and of course the stitches are still in, so everything's still a bit black and blue down there. I took a mirror down there, so don't be me. But like 6 weeks later, that's when things have started to heal. So that's when you might notice that things aren't quite how they should be, and you might need to refer. Would that be part of your role then, to refer people on if you think?
That's right. So if we were worried. At that point, they might notice I'm still sort of leaking a bit when I cough and sneeze. You might want to get that assessed, get the physio referral sorted. If there's any ongoing bleeding at that point, the bleeding's not settled, you'd be worried about any infection or any bit of placenta that could be left. You might need to refer back to the obstetrician at that point. And yes, if it's not healing well, then tear might need to be looked at again with obstetrician.
And I guess it's quite common. All these things are quite common. They're you see it probably as frequently as you see someone that you're like, oh yeah, you're fine.
Exactly. Yeah, and it's just getting checked, isn't it, and sort of making sure everything's okay.
And letting people know that it's okay, because I think even though I felt like I went into pregnancy and giving birth very well informed, when it happens to you, it's just a different ball game, isn't it?
Oh, completely.
It's just mind blowing when these things happen to you. So I think letting people know that it's okay and that these changes aren't forever.
That's right. Yeah, exactly. I mean, at first your body is just, it feels, everybody wants a piece of it, and you're breastfeeding, all this is going on. It's it's hard to feel like your old self actually at the beginning, and that can change, and you get more active and mobile, and things sort themselves out in time. But you might need a little bit of help at the beginning.
And so do you work with a team of specialists, or how does it work in Singapore? Because private healthcare can be difficult here, right?
That's right. Yeah, I mean, we like to identify specialists who are good with our patients, who particularly because we have a lot of expat patients. So specialists that will suit our style, I guess, and we're always grateful for feedback from our patients about how they got on. So we tend to sort of channel them to people that we think would suit them well.
Oh, great. And I remember it's a two-way thing as well, because I remember when I saw my obstetrician at my 1-week checkup, and she said, oh, you see Dr Maithili, you can see her for your 6 weeks if it's near your house.
That's right.
And I remember being like, yes, because to get out of the house, to go to the hospital with a baby, it was like a 2-hour process.
It's a military operation, leaving the house with a baby sometimes. That's right, making sure you've got everything. And we see that on the East Coast a lot, actually. Particularly for baby checks, patients are happy when they realise, oh, my GP can do this round the corner, and I don't have to keep going back all the way to the specialist.
It's amazing. And is there anything that IMC or you are currently working on that is exciting?
So at the moment there's lots of talk in the clinic amongst the doctors about putting together a well mummy check. So it's a postnatal check, basically, because we do see this need, and we've had patients telling us that they don't always have that kind of comprehensive check at that time. So we are still working on it, but it's something that we're hoping to propose quite soon.
That's fab. And that will be kind of a multidisciplinary approach? Will it be a GP-led thing?
It will be GP-led, and then if something's highlighted or we need further input, then absolutely, we can sort of refer on as needed.
How has COVID affected your doctoring?
Oh gosh.
Your medical practice?
So gosh, what a year was 2020. Well, a lot of change happened that year, and I think it's just over a year now since the first case in Singapore, and I don't think we anticipated what was going to come. I mean, it was challenging at the beginning, keeping us safe in the clinic, keeping our patients safe, directing the people that need to be tested to the right place, and constant guideline updates every week to kind of read pages and pages and know, right, this is the plan now and this is what we're doing. I mean, Singapore did a fantastic job in managing it. So the biggest thing I'm now seeing, I think, is mental health. I think we're still seeing a lot of that. And I think now it's quite often anxiety that I see, because anxiety comes from a place of uncertainty. I think as human beings, we like the predictable, we like the routine. It gives us that sense of control when we know what to expect each week. And when COVID came, that just went out the window. We don't know when we're going to travel. We didn't know was there going to be a vaccine? Is there a treatment? What does this all mean? So I think anxiety has been the dominating symptom throughout all this time. And for anyone who already suffers with anxiety, it's been quite challenging.
I can imagine.
Quite a range of emotions. At the beginning, I even saw, I think, a generalised grief reaction, going through all the stages of grief, losing our old carefree life, and going through the anger, you know, why should I have to do this? Why am I having to wear a mask, you know? And then the searching, well, maybe we could do this and then it'd be okay. And then
we'll
the denial.
Get back by
we'll
Christmas.
definitely, yes, that's right.
As long as we'll be fine by Christmas.
It's like Groundhog Day now, isn't it? It's like, we're going to go back this Christmas.
I know. And with the people that you were seeing for anxiety, I guess that wouldn't just be mums, that would be everybody. And it's good that we're seeing everybody. I think the stigma is starting to be broken down now with mental health, which is great. And also with men. So it's good that they're coming in because for a long time I don't think men would, partly due to stigma really, that they wouldn't come and get help. But there's a lot that can be done, and sometimes it's just a case of giving a safe space, a non-judgmental place to talk about what's going on, and that might be all that's needed, with some suggestions about lifestyle and exercise and stress management, mindfulness. There's a lot that can be done. And obviously onward referral or medication where it's really needed. And I guess you as a GP are quite a safe person to talk to. It's not like going to a psychiatrist. You know, somebody can come to you and know that they can have a conversation and not be worried about, you know, because there is that stigma of repercussions, isn't there?
That's right.
But speaking to a GP, you know that you're going to be listened to and you'll be advised, but you're not going to be forced into anything. So I guess for a lot of people, I know that I would probably feel very comfortable coming to my GP as my first port of call, just to find out what my options were. Yeah,
I think that's it. And we have that opportunity to build a rapport over time and know the family, so we know what's going on. So we understand when someone's suddenly, you know, feeling low or down, if we understand what the dynamic is. So it's a good position to be in, I think, for looking after mental health.
Absolutely. Thank you so much for joining us. That was amazing. So much information that I think will be very, very useful for everybody. So.
Brilliant.